Turning now to the coronavirus, the director of the Rhode Island Department of Health says an estimated 90% of infections are now the Omicron variant.
Meantime, the state is focusing on alleviating some of the stress inside of hospitals while increasing capacity for testing and vaccinations.
12 News reporter Alexandra Leslie joins us now live in studio following the first COVID-19 briefing of the new year. Alex?
Well, Mike and Shannon, both Governor Dan McKee and Lieutenant Governor Sabina Matos have particularly strong but different sentiments for the roughly 10% of Rhode Islanders who have not received any doses of the COVID-19 vaccine yet.
Individuals who have not been vaccinated, they've made up their mind.
While Governor McKee says Rhode Islanders should respect that decision, he noted during a visit to Rhode Island Hospital last week, hospital staff said somewhere between 50 and 75% of those hospitalized were not vaccinated.
So to our friends that are unvaccinated, a word of caution. Be safe. Take the precautions that you need to be safe.
Lieutenant Governor Sabina Matos had a different message.
I want to ask you one more time to reconsider your decision.
Matos said she has friends and relatives who are not yet vaccinated and has also known those who died from the virus who didn't have the shot.
So I want to ask you to one more time, think about it. Think about people around you.
She also read this message in Spanish,
Tengo amistades, tengo familiares que
adding while she has had her vaccine and booster shot, she still tested positive for COVID-19 over the holidays.
you really don't want to get this. I honestly am convinced that if I had not gotten my vaccine and my booster, I probably would have been one of those cases that ended up in the hospital.
Governor McKee says 40% of adults have gotten a booster shot compared to 32% of the population getting a booster.
We've got work to do here.
And the state announced 9 community-based COVID vaccine clinics will be held tomorrow, Thursday, in Providence, Barrington, East Greenwich, Lincoln, and Wakefield. While the governor also noted the state has made 65,000 appointments available per week for vaccines overall. And there is also a major focus on reducing stress in hospitals. 12 News reporter Anita Buffoni has more on that effort and how the National Guard is playing a bigger role. Anita?
Well, Alex, thank you. More National Guard members will be mobilized at local hospitals. This is part of the state's strategy to place 60 of those National Guard members at Butler Hospital, where non-critical care patients can be transferred to in order to free up beds at other hospitals.
Our team has been digging in on this.
After several weeks of coordination between the McKee administration and hospital leadership, the state lays out specifics as to how they plan on addressing the staffing crisis at area hospitals. A total of 200 National Guard men and women will be deployed to various hospitals and emergency rooms, 60 of which will be stationed at Butler, a psychiatric hospital in Providence.
Will enable the hospital to increase its capacity to accept patient transfers, allowing other hospitals to send non-critical care patients to Butler.
The strategy aims to free up beds at other hospitals. Head of the Rhode Island National Guard said they are being deliberate as to who and how to utilize its members.
This particular effort has been to ensure that we can bring on National Guard personnel, that we can meet the tasks that we've been able to meet, but that we don't harm the staffing levels of the state police, the sheriffs, the Department of Corrections, the broad majority of our first responders, and our medical personnel.
They will help with tasks such as transportation, patient observation, and other jobs that don't require a high level of medical expertise. Now, in addition, the governor is working on a plan to expedite temporary licenses for recently graduated nursing students to get them in the workforce more quickly to help address those staffing levels. They're going to be working with colleges like CCRI, URI, and RIC to help bring awareness to this plan. In the control room, Anita Buffoni, 12 News.
Steph, thank you. Meantime, the head of the Rhode Island Department of Health estimates Omicron cases now make up roughly 90% of all new infections in the state. Just today, the health department added another 85 identified Omicron cases to the number they reported yesterday. The Omicron surge was one of several topics at the governor's first COVID briefing of the new year this morning.
The governor also announced plans to deploy more National Guard members to help staff at Butler Hospital in efforts to expand COVID testing. 12 News reporter Alexandra Leslie begins our team coverage with a major update for one test site in Warwick. Alex?
Mike and Shannon, this will be a first for Rhode Island. Starting tomorrow night, CCRI's night campus, which is a drive-through rapid testing site, will be open 24/7. This means people who aren't able to access testing during typical business hours now have a way to get tested. Those rapid test appointments are already available on portal.ri.gov, and Governor McKee says there are improvements with PCR test turnaround times, too.
On average, just over 2 days. We know that's not yet the case for everyone, but it's good progress.
PCR results have been taking anywhere from 3 to 5 days in recent weeks. As McKee said, the state is doing more testing than at any other point in the pandemic, with 175,000 tests administered last week alone.
Almost the population of Providence. 17% of the state of Rhode Island in 1 week.
100,000 additional at-home rapid tests are also on the way.
We have some additional shipments that should be coming in the next few days.
Health Department Director Dr. Nicole Alexander Scott says the state continues to see COVID-19 cases that are extremely elevated, with a percent positive rate well above 15% since just before the new year.
One of the helpful things is that there are fewer cases that lead to hospitalizations this year when you compare it to last year.
However, the health department director noted the sheer number of cases Rhode Island is seeing
means that our number of hospitalizations is near the levels, if not surpassing, what they were last year.
Governor McKee says the state is also focusing on reducing stress inside hospitals and plans to utilize more National Guard members to help do so.
The good news is that we could be nearing our peak for cases and hospitalizations.
Of course, vaccines also discussed today, with the governor telling us the state has about 65,000 appointments available per week. And as we mentioned, the National Guard is also playing a major role inside hospitals. 12 News reporter Anita Buffoni has that part of our coverage now. Anita?
Well, thank you, Alex. Part of the state's strategy is to mobilize 60 of those additional National Guard members to Butler Hospital. That way, the non-critical patients can be transferred there to free up hospital beds at other locations. A total of 200 National Guard members will be mobilized as part of the state's strategy that's been in the works for several weeks. But some National Guard members have already been in the hospitals when Governor McKee remobilized them last month. For the 180 members already in Rhode Island hospitals, what are they seeing on a ground level?
As the governor mentioned, we have about 60 that are focused at Butler. At this point, 75 are working a new vaccine effort at the Rhode Island Convention Center, which appointments are available. We've got 25 personnel that are assisting in Central Falls with the walk-in clinic there.
General Christopher Callahan, head of the Rhode Island National Guard, said its members will handle tasks such as transportation, patient observation, and other jobs that don't require a high level of medical expertise.
As part of an initial strategy and increase capacity and relieve pressure on other hospital emergency departments.
President of Butler, which is a psychiatric hospital in Providence, said in a statement, Butler Hospital will temporarily repurpose Ray Hall Conference Center to serve as a 25-bed unit for behavioral health patients who are boarding in emergency departments across the state. And the National Guard isn't the only way that the staffing levels will be helped by the state. The state is looking to grant temporary licenses for recently graduated nursing students to help get them in the workforce more quickly. They are going to be targeting students from CCRI, URI, and RIC. In the newsroom, I'm Anita Buffoni, 12 News.